So again, Addison's, we have an absence of steroids. We need to add some steroids, guys, so everything will be low. We'll have low blood pressure, which is the most critical. We'll have low weight from that water loss. Keywords here, very skinny and very weak. We'll have low temperature from that cold intolerance. Low hair, known as hair loss or alopecia. Low mood or depression or irritable. Low energy, low sodium, guys, big one here. Hyponatremia, 135 or less. And this comes with a big salt craving. Also slow or irregular periods or menstrual cycles. Now, Addison is usually caused by our memory trick ADD. So A for autoimmune disease, where the body basically kills the adrenals or pituitary. This is called a primary cause. Or secondary causes from D and D, like diseases like cancer or infection like TB, and even just trauma to the adrenals, like from a car accident or falling off a roof. So for Addison, we use the acronym ADDI, like Addison's disease. We Addson, guys, those steroids during times of stress to avoid that Addisonian crisis. So big test tip right here, guys, write this down. Teach patients to tell their doctor about increased stress from work, school, or emotions. We have to increase their steroid doses, guys. Always stressful times, we increase the steroids. Huge NCLEX favorite. Now D is for a diet high in protein, carbs, and sodium. Cortisol helps convert proteins, carbs, and fat to energy, so keep these high in the diet. Also, don't stop taking steroids abruptly. Guys, we never abruptly stop hormones. In this case, it leads to Addisonian crisis. BP so low it will cause death, aka shock. And D, don't believe this medication will cure you, guys. It will not cure you. Always more education is needed for any patients thinking hormones will cure them. And I, indefinitely on this medication. This is a lifelong hormone replacement therapy, guys. No cure. You're always on hormones, what's known as a forever drug. And lastly, we can always wear a medical alert bracelet to prevent Addisonian crisis. We always teach patients to slowly taper off, never an abrupt stop. And again, for stress and surgery, we always increase the dose with increased stress. Write that one down. I saw that one like 3 times on the NCLEX review.